QEd Productions presents Drugs in Our Society. Filmstrip 1, Tobacco, the Habit and the Hazards. The practice of smoking was introduced to European culture from the New World by Columbus and other early explorers. Its use spread rapidly throughout Europe. By the early 17th century, tobacco smoking was well established. The economy of many American colonies depended heavily upon tobacco growing. Smoking became a way of life for many in America, and it still is. However, during the last 20 years, it has been shown that tobacco is not only a way of life, but also a way of death. Enough positive scientific evidence is now available to convince anyone with an open mind of the dangers to health and life that tobacco smoking presents. Before we discuss these dangers, let us review the normal structure and function of the respiratory system. Our respiratory passages have several built-in mechanisms which protect the delicate air sacs deep within the lung. It is important that air entering these air sacs be free of dust and dirt particles. The first protective device in the air passageway is the nose. Here, large areas of tissue, which are lined with mucus, trap larger dust and dirt particles. Air passes through the throat down into the voice box or larynx. The larynx is protected during swallowing by a small valve called the glottis. Below the larynx is the windpipe or trachea. This divides into the two large bronchi, one for each lung. As the bronchus enters the lung, it branches into smaller and smaller bronchi. The smaller branches are called bronchioles. At the end of the smallest bronchioles are the delicate air sacs. These are the alveoli. Each alveolus is composed of a thin layer of cells. From the large bronchi down to the tiny bronchioles, the walls of these air passages are lined with a protective layer of mucus. This mucus traps small particles of dust, dirt, and other foreign substance, and is responsible for the final protection of the delicate alveoli. This thin layer of mucus is secreted by cells lining the bronchi and bronchioles. Such cells are called goblet cells because of their shape. The thin layer of mucus is moved by tiny hairs or cilia, which extend from the tops of long cells called ciliated cells. The cilia move back and forth with a brush-like action. The function of the cilia is to sweep the mucus layer upward in the air passages. The cilia move the carpet of protective mucus higher and higher in the air passageways until it reaches the throat and is eliminated from the body through the stomach. The chemicals, particles, and gases contained in tobacco smoke are very irritating to the cells lining the bronchi and bronchioles. More mucus forms to protect this lining. Tobacco smoke also damages the tiny cilia. Long-term smoking causes many of these cilia to disappear, and those which remain function much less efficiently. The result of the increased production of thick mucus and the decreased action of the cilia cause mucus plugs to develop. These obstruct portions of the airways and must be removed. The body removes these mucus plugs by coughing. A cough is a sudden and forceful expiration of air. The irritative effects of smoke also act directly on the cells of the airway. The walls become red and swollen. White blood cells crowd into this area to combat this inflammation. This causes a narrowing of the walls of the air passageways, making it harder for air to get in and out. Breathing becomes more difficult. The narrowing of the passage walls and constant coughing greatly increase air pressure in the alveoli. In time, many will weaken and burst. As alveoli are ruptured and destroyed in large numbers, more air is trapped deep in the lungs. The lungs are forced to increase in total size, This is the disease called emphysema. Emphysema now occurs almost exclusively in heavy smokers. Emphysema leads directly to more than 20,000 deaths in the United States each year. Thousands of other smokers are made respiratory cripples by this disease. Many hospital wards are filled with patients who have severe emphysema. These patients must fight for every breath. Smoking is the major cause of emphysema. In addition to the inflammation and narrowing of the respiratory passages, the irritative effects of smoke cause other problems. Cells unprotected by the normal mucus layer become exposed and eventually undergo certain changes. Many cells become disorganized and lose their normal structure. If these changes progress far enough, the cells become so disorganized that they begin wild, uncontrolled growth. This is called cancer. Cancer cells may be carried by the bloodstream to other parts of the body. Unless removed by surgery, destroyed by radiation, or special drugs, the cancer is fatal. Cancer of the lung kills nearly 50,000 Americans each year. Lung cancer is very rare in people who have never smoked. Smoking is the prime cause of cancer of the lung. Other cancers in the body are closely related to the habits of smoking. Cancer of the lip occurs almost exclusively in pipe smokers. Cancer of the mouth and larynx occur almost exclusively in heavy smokers and practically never in people who do not smoke. Some of the substances in tobacco smoke are absorbed in the bloodstream and are excreted via the kidneys and bladder. Certain kinds of cancer of the urinary bladder occur more frequently in heavy smokers. Other substances in tobacco smoke are absorbed by the lungs and cause physical damage to other parts of the body. One of the principal areas is in the heart and blood vessels, the cardiovascular system. The exact substances in cigarette smoke which create these changes have not been fully identified, but the scientific evidence available is only too clear. The smoking habit contributes substantially to diseases of the heart and blood vessels. 600,000 Americans die each year from disease of the arteries which supply blood to the heart itself, the coronary arteries. Many of these deaths are caused by smoking. Men who smoke heavily have earlier and more frequent heart attacks than men who do not smoke. Other diseases are also more frequent in smokers. These include ulcers of the stomach, certain disorders of nerves, and disturbances in the heart rhythm. What is it in tobacco smoke that causes these changes? Again, many scientific experiments have proved the facts beyond a reasonable doubt. One of the main components of cigarette smoke is nicotine. Approximately 3 milligrams of this potent chemical are found in the smoke from an average cigarette. Nearly 90% of the nicotine in each cigarette is absorbed through the lungs and is carried to all parts of the body. The physiological effects of nicotine are well known. Nicotine increases the blood pressure and the pulse and causes narrowing and spasm of the small arteries throughout the body. Other biological effects of nicotine include central nervous system and mental changes and a decrease in the appetite. In larger amounts, nicotine causes nausea and vomiting. It is these effects of nicotine which account for the nausea, headaches, and other unpleasant feelings that accompany the first cigarette. These are symptoms of the body's rejection of tobacco smoke and make smoking a difficult habit to begin. However, with patience and persistence, most people can learn to smoke. The body can be forced to accept these chemicals. Smoking becomes a habit. Once the habit is formed, the smoker's body depends upon tobacco smoke, and he will often become nervous and fidgety without it. When the habitual smoker attempts to quit smoking, he may try using candy and chewing gum as a substitute for tobacco, but this only partially helps to relieve the terrible sensations. This is one of the major characteristics of addiction. although smoking is officially referred to as a habit. In addition to nicotine, cigarette smoke also contains certain solid chemicals, tars and resins. 7 of these chemicals in high doses are known to produce cancer. Smoke contains traces of arsenic and other metals, as well as some radioactive isotopes. These tiny quantities may produce damaging effects to the body by accumulating over many years. Small amounts of several toxic gases are the third major component of smoke. In high concentrations, these are themselves irritating or poisonous and include carbon monoxide, methane, ammonia, cyanide, and hydrogen sulfide. Certain products of the burning cigarette paper may also be harmful. Insecticide sprays used on the leaves of the tobacco plant may be present in tiny quantities and build up slowly to poisonous levels. The heat of the cigarette smoke itself may be injurious. The temperature of the smoke from a cigarette may reach 160 degrees Fahrenheit. Cigarette filters do very little to decrease the hazards from chemicals and gases. The only really effective and completely safe cigarette filter would be made of solid concrete. Young people often begin to use tobacco to prove maturity, sophistication, or independence. With knowledge of the facts, people who choose smoking must admit that they are assuming a significant health risk. Teachers, health agencies, and physicians warn of the dangers of smoking. Although these warnings are often much less attractive and appealing than many cigarette ads, the facts now speak for themselves. The habit is hard to start, but much harder to give up. The decision to smoke has to be an individual one. It should be made with a thorough knowledge of all the facts, all the consequences, and all of the very real dangers.